I guess a question that I want to lead off with, and I think it's going to be a fairly difficult question, but that's me. But and somewhat inspired by a workshop actually that Dr. Birnbaum and I participated in about a year ago. And that's a problem that we're beginning to appreciate, which is that many of the chemicals that Dr. Zota studies and that Dr. Cohen has been monitoring for the EPA actually seem to have a potential to impact on obesity, the problem that Dr. Clifton is studying. And in fact, that we're beginning to see that it's an array of the very same chemicals that Dr. Birnbaum had presented that seem to be triggering hormonal changes that are not favorable in terms of our metabolic state. And how do we bring together the data that we need to bring together to look at a problem like this when we have not, your research on obesity hasn't really monitored the chemicals, your research on chemicals hasn't really looked at this problem of obesity. We've kind of tended to be in different silos, and that's even true in the National Institutes of Health, that obesity kind of sits in the NIDDK silo, and obstetrics sits in the NICHD silo, right, and environment in the NIEHS silo. And perhaps start with Dr. Cohen and move my way to Dr. Birnbaum, kind of from right to left. But
well, I'm guessing that one problem with obesity is that one reason why people are obese is probably they're eating food that isn't good for them, and prepackaged food. I don't know why I'm saying this, because I'm probably an example of it all, but nevertheless, prepackaged food has nasty things in it, and so you're going to get worse environmental exposures just from the sort of food that you eat.
That's an interesting point, and it is very true, and I should have said it right out front. It is very true that we know that a major factor is, of course, that we have an unfavorable energy balance across our population, and that we are taking in too often more energy than we're expending. However, this evidence says, yes, that's true, and at the same time, these chemicals really are having these hormonal impacts. Ami?
I think to further that, I think too long environment and nutrition have been siloed, and as Dr. Birnbaum said, there isn't that much difference between the chemicals that we study as nutrients and the chemicals we study as unintentional contaminants. And I think obesity in particular is a disease that really requires integration of these two disciplines, whether it's those expertise coming together in a cohort study, but as well as at the experimental level to understand, how fat versus carbohydrates, what does that do to the metabolism or transport of these chemicals in the body.
Now, you recently had a study that actually showed what Dr. Cohen was hypothesizing in terms of the fast foods and chemicals are associated, correct?
Right. So we found 20 to 40% difference. So people who ate a high amount of fast food in the prior day, there's people in the U.S. that are eating 35 to 100% of their calories from fast food. These people had 20 to 40% higher levels of these phthalates. And interestingly, we also looked at whether it was driven by the fat in the fast food, and that was part of the picture, but not the entire picture. That's interesting because the phthalates are coming from this food that may be a risk factor for obesity, but then phthalates themselves may also be a risk factor for obesity.
Rebecca, did you?
Yeah, I would just add that I think it's really important to continue cross collaborations across institutes. So the consortium that I described, looking at lifestyle interventions, that is NIDDK is the primary institute, but we also have funding from NHLBI and NICHD. And so I think it's important to bring these groups together to evaluate that, and then also to have rigorous means to assess diet and to also collect samples. So I know for all of our projects that we're collecting blood and urine and cord blood and placenta so that we can look at exposures to other chemicals.
I mean, when you saw Dr. Birnbaum present the cheer thing, is that a kind of an opportunity that you could use? It looks to me like it could be a potential avenue to get some of that exposure measurement done.
Absolutely.
Absolutely. I'm never going to give anyone a buy on eating too much and not exercising as part of the contributors to obesity, but I don't think it's the whole thing. There's a whole new science of obesogens, which are chemicals which basically alter your body set point. And early life exposure, there are a large number now of experimental studies using animal models, and there are human studies that are showing associations with certain kinds of chemical exposures and elevated body weight. For example, in children, which once you are an overweight child, you often become an overweight adult. So smoking is one of the best examples, and I mentioned that before, that in utero exposure to smoke is associated with obesity. There have been, well, a couple years ago, it was 23 studies, which were also the association with overweight, obesity, and type 2 diabetes. There have been more studies since then where they followed the children who, at one point, they had children who were 8 to 10, and now they have people they're following at 20 to 30. We know from some of the studies of nutrition, if you go back to the hunger famine that occurred in Holland in 1944, when there was nutritional deprivation in the Dutch people. The Dutch famine is actually what they call it. And those, not only the people who were in utero at that time, but when they grew up, they had a higher risk of obesity and type 2 diabetes, cardiovascular disease, and cancer, and now we're seeing overweight and obesity in their children. It becomes very difficult to disentangle some of the what's going on. We think this is an epigenetic association that we're seeing, but we have lots now of environmental studies of different kinds of environmental exposures in utero, which are being associated, and some I think I even mentioned preconceptionally, which are associated with overweight and obesity in the offspring. And I really, I don't think you can blame a young child for their overweight. I do. Can I raise another question? I want to challenge Rebecca a minute about her study with the hypothyroxanemia and the hypothyroid. And you treat that once the women show that they might have their elevated TSH. Mm-hmm. That may be too late. And so are we beginning to recommend, I think a lot of our recommendations of things to avoid, for example, or treatments to give are occurring too late. So we know, for example, that the addition of folic acid to food supply has resulted in a very significant decrease in open neural tube defects. But we're beginning to find that folate may actually be preventative, for example, or reduce the risk of autism. But when is that happening? Well, it may be happening preconceptionally and up through the first 8 weeks of pregnancy. And that's not the time that a woman has gone to her doctor and started taking pregnancy vitamins. So we need to begin to focus, I think, more on men and women of childbearing age and improve their health status in order to have healthy children in the future.
So excellent point. And one of the things that certainly did happen with the folate is that when the science really came in to say you need to have folate sufficiency even before a woman becomes pregnant, that at the time of conception that she needs to be in folate balance. That was why the decision was made to supplement the food supply rather than to use a pill, because once you realize you're pregnant, it can be too late. A lot of people don't recognize pregnancy the very day it happens. Other people do. I realize that. Some of you in the room probably, but I think that for most people, by the time the pregnancy has been diagnosed, if you don't have enough folic acid, it's too late. And it is certainly true, and it's something we don't talk about very much, that many people in our country don't have enough iodine in their diets. Because one of the things that is true, that the public health approach to iodine was to supplement table salt, but if somebody has 100% of their calories coming from fast food, like some of the people in Dr. Zota's study, they're not even using that. And there isn't necessarily iodine in many of those processed foods. And there is data that there are people, even in this country, who don't have enough iodine, don't have enough vitamin D. It's crazy. But I don't know if you have a comment on that. I mean, what kind of study would you have to do in order to, you would need a preconception study.
Right, and I think I definitely think that we need to shift towards preconception. It's a very big challenge because I think 50% of pregnancies are unplanned. And so I think that creates a very big challenge. For the studies that we have done on pregnant women, it's extraordinarily difficult to recruit them early in pregnancy. We try to focus on that first prenatal visit, but there are a lot of women, especially those low SCS, that do not come in for prenatal care until 20 weeks. And so it's one of our challenges that we have as far as trying to get the interventions, whether it's the lifestyle interventions or treatment of some form early in pregnancy to actually make a difference. So no, it's definitely a challenge.
So I was wondering, Linda, what you were going to say when you brought that up, because it's something that occurred to me, and that is that does the synthetic thyroid hormone actually correct the thyroxinemia? Does it actually correct it? Because I mean, especially if you're seeing a higher TSH, what is that actually indicating? And because if you're seeing that and it's because you don't have enough iodine in your diet and you're not making thyroid hormone, I think you can correct it by replacing it. But I think if you're seeing it because you're exposed to an environmental contaminant that's blocking a receptor and causing the production of TSH, that's still happening, whether you give the synthetic thyroid hormone or not. And so I think that's another consideration, at least for elevated TSH. Why is that happening? It could be you don't have enough thyroid hormone around, but it could be because the receptors are blocked and there's just there's a disruption of the thyroid system.
No, I totally agree. But I really think the point I was making even more is going back to the issue of critical windows. Right. And we know that so much of the role of thyroid in neurodevelopment is occurring very, very, very early. And that's true for other things as well. I actually took out a slide, because I had too many as it was, where I kind of looked at the different developmental windows, and things that are happening within the first 8 weeks of pregnancy. The heart is formed, totally formed then. And so if you have something which is a cardiotoxic drug, it's probably not going to have much of an, or would affect cardiac development. You have to have exposure earlier in order to impact it, because you've passed that window. So we have to think about when are the susceptible periods. And again, the point that I tried to make is that different things happen in different windows. So, a given, say, chemical exposure like the phthalates may do one thing preconceptionally, they may do something else during the first trimester, something else later on, something else in infancy. And we somehow have to begin to look at all those factors.
Another point I just wanted to add, I know you focused on neurodevelopment, but the thyroid gland is particularly vulnerable during pregnancy. Pregnancy places a high demand on the thyroid gland, and that can also have repercussions for the woman independent of the child, right? So thyroid fluctuations, people are suggesting it's a risk for postpartum depression, which clearly affects the child, in another way, as well as chronic disease in the woman later in life. So I think there are also other endpoints that may be relevant to women's health from thyroid disease during pregnancy.
So I want to shift gears a little bit. We heard a little bit about how environmental data that EPA collects are available on the web, and we've heard a lot about exposures that we can measure directly in people, whether in blood or urine or otherwise. But there are a lot of exposures that are very difficult to measure, such as exposure to air pollution. And although some people have succeeded in putting devices on study subjects that they carry around in backpacks and so forth, normally we don't have that kind of information, and certainly for something like NHANES, we don't have that. I think for very large studies, we'll never have that unless it could be made a lot smaller and cheaper, a lot smaller. But how can we use really the wealth of data that are available to help to impute exposures for people, for things that we can't take direct measurements? What are your thoughts about that in terms of the statistical challenge of doing that. Take air pollution, for example. There's so many measurements, and what do we do? How do we decide what people are actually exposed to?
Well, as you say, that there have been quite a few studies where they actually do have people, with an air exposure, monitor on them, and they walk around and they, you measure their exposures in different microenvironments, indoors and outdoors, and then they can be used. So that data is useful, and there are several models that take that data and sort of model somebody's exposure over a longer period by following them from microenvironment to microenvironment, taking into account their activity patterns. So
So in fact, air pollution, I think, is something that we do a better job of. Outdoor air pollution, a better job of managing. Since indoor air pollution isn't regulated, nobody measures it unless they're specifically looking. But outdoor air pollution, we have different kinds of, we have stationary monitors that are set up that EPA has in a vast database, and that's the kind of modeling then you can impute what people might be exposed to. You also have mobile monitors, and then you have the personal monitors. And we're getting better. We can now do air pollution monitoring, and the monitor is the size of a deck of cards. So it's not something that is terribly difficult or terribly invasive to wear. We also have developed, Kim Anderson at Oregon State has done a great job of developing these silicone bracelets, basically, wristbands that come in different colors. We actually have been trying them out in the field in some of our children's cohorts. The only problem is the kids don't want to give them up at the end of the study because they like these color bands. So we now substitute bands that don't have the sensors in them. But they can pick up 100 different kinds of volatile organic chemicals on these wristbands. So I think this is a very powerful tool, especially if you want to do some kind of longitudinal exposure and follow what's going on. So I don't think it's not doable. I think in very large population exposures, you're going to have to use the different models that have been developed to predict, at least in a given area, what the exposures may be. So with all the kinds of GPS and the mobile health technologies, if you're carrying your smartphone around with you, in fact, you can be followed wherever you go all the time, and there can be air measurements that are being made at the time. Now, they may tell you that there's this much PM 2.5. It doesn't necessarily tell you what the composition of that PM 2.5 is, which is a whole nother issue.
So I wore one of Dr. Anderson's bands for a week, in a small study that Environmental Defense Fund did, and found, much to my surprise, not really, that it was picking up caffeine metabolites right from my skin. Mm-hmm. Do that every day. But also things that I wouldn't have expected, like galactoside, which everybody in that little pilot study had picked up in their band. And we don't think about that very much, but there are a lot of things in cosmetic products and personal care products that, it was a little humbling for me. I hadn't thought about that very much. And some of these products will say fragrances, but they don't say what they are and what the vehicles are. So I thought it was actually not only something that could be promising in terms of doing research, but also just helping people to understand what's there, and perhaps, the kind of thing that an agency like EPA or FDA might want to know in terms of, gee, if 100% of people are exposed to this, what do we know about it? And at least galactoside, I looked at that because I was curious about that. Not a lot. It's kind of interesting.